My name is Terje Eikemo. I'm a professor of sociology. Yes, sociologists work on health issues, so that's if you didn't know. And I lead a center that is called Center for Health Equity Analytics. And we are a center that is focusing on global health. So health is relevant all across the globe. So for that reason, we are global. And we focus on the social differences that are both the reasons and consequences of our health situation. So we are monitoring these inequalities with the WHO, for example. We are explaining their causes, and we're also trying to find the right solutions to reduce health inequities. So those are the three pillars of CHAIN. So CHAIN is the short term of our center, and also in a few minutes Insa. Insa Backhaus will go through some of the results that we want to show from the make it healthy pillar. I'm not sure, Insa, if you want to say something now or if you want to introduce yourself once you start. I think you can say hello or something, and then
Yeah, maybe I do it now so I don't interrupt the presentation then. Yeah, I can only echo Terje's word. Really excited to be part of this really great project and yeah, to be involved in the Make It Healthy pillar. I am a postdoctoral fellow at Chain and I look primarily at health inequalities in Europe. That's why this project is so fitting to me. I do a lot of cross-country analysis and look at how yeah, health inequalities vary and which countries are most affected. And you will see soon that I look primarily into social factors, education, for example, but also working conditions and so on. And yeah, happy to present the findings of two of the reports that we have written as part of this project. And I give it back to Terje.
yes, and just a few more words. I wanted to congratulate all of you who are here, and why is that? Well, first of all, this is the topic of today is of extreme importance. Health is the first resource we're given when we're born. It's a resource that we keep with us through our lives, and which both creates opportunities for us and restricts also access to services and to all our dreams. So it is so essential in our lives. And it is basically also a social divider. Those with better health are better able to obtain their dreams, and others not. So as social scientists, we usually look at health as something that points back to the social conditions from which we are raised, that we are born into, that we live through, and that we age in. Now, the second reason why I wanted to say how such a great idea for you to be here is that the data we are presenting today are quite unique. They are unique because they are recent. Sometimes it's you need to know the current situation in order to act, in order to understand what is going on. So they are recent, and they are also really widespread, meaning that we tap into different areas of society. From you will see today that we look into housing conditions, healthcare access, all of these kind of social areas of life that creates these opportunities for us that enables us to live long and healthy lives. We will also show you today that it makes sense to present data in an easy fashion. Sometimes we tend to use very advanced analytical tools to show how impressive our work is. But sometimes, it's enough to just present the data as they are, and that can provide really, really powerful messages. So today we are presenting data in a very descriptive way, and so the main kind of issues we look at is age. We will look at education, if you live in a rural or urban area. So these kinds of information that we combine, and this provides stories that are kind of easy to tell. Now, the final reason why this is such a good idea, and that is something I'm also looking forward to, that's the next session when you are yourselves going to learn how to analyze the kind of data that we have been looking into today. I'm a lecturer myself, and I look forward to integrating the data we are presenting today in the teaching, because this is this is a gold mine for you to use. It's not just recent; it is really it taps into the areas that are of so high importance today. I'm not going to talk for much longer. This is the last slide here that you'll hear from me, just to show that there are substantial variations in access to central goods in Europe. There are differences in access to the social determinants that really leads to differences in how we feel. And why is that? So now I think Insa, it's about time that you take over. I will come back a little bit later, and when we are going to discuss what's next. So what should we do about this? And also look forward to hopefully a discussion with all of you. And I encourage you to write down the kind of questions you have, and that can promote a nice discussion afterwards. So Insa, over to you.
Yes, thank you. Thank you for the introduction, Terje. So when we talk about differences in health, one indicator that we can always look at in how a country does, or how Europe does, is we look at life expectancy. And what we can see here is that the life expectancy, even though the countries are quite developed or highly developed, varies substantially. We see the highest life expectancy in Italy and Sweden and Spain, and the lowest life expectancy, for example, in Bulgaria, Romania, and Latvia. And that despite the fact that everyone should have somewhat equal access to healthcare. So everyone should have the opportunity to live a healthy life and get the care they need. When in sociology we try to explain why we see differences in health, we often look at the social determinants of health, and we often use a framework that was published already more than 30 years ago by Dahlgren and Whitehead, which nicely shows that we have some non-modifiable factors which are at the center. These include age, birth, sex at birth, and genes, for example, which are surrounded by modifiable factors. These include, for example, individual lifestyle factors that are, for example, smoking and dietary habits, drinking habits. They are surrounded by social and community networks. So how well do you get along with your neighbors? How many friends do you have? What does your social capital look like? And these are again surrounded by wider living and working conditions, your education, the work environment, but also healthcare services, housing conditions, and unemployment. And these are essentially conditioned by the general socioeconomic, cultural, environmental conditions. So how politics shape basically the living and working conditions, the social and community networks, and the individual lifestyle factors. And the social determinants of health, and that's what the framework shows, are therefore the conditions in which people are born, grow, work, live, and age, and the wider set of forces and systems shaping the conditions of daily life. And this is not a definition of myself. This comes from the World Health Organization. And like I said, we use this framework and even more complicated frameworks to investigate why we see differences in health across Europe or across the globe. And this framework also guided our research for the Infra for Next Gen project, for which we published two reports. One is the data summary, and one is the top-line report. In the data summary on the left side, we use data from various sources, such as the European Social Survey, the ISSP, whereas in the top-line report, we primarily use data from Kronos, which is a sub-survey from the European Social Survey. I will present today some findings of both reports. Like Terje said, these are descriptive. We did not do complicated logistic regression analysis or multi-level analysis. We primarily wanted to look at differences in health in a descriptive way. And these reports are also available on the Intraphonics Gen website. And I will not talk a lot about the data sources because David will give a presentation on that, but just to give you a brief overview, these are the sources that we use. The European Social Survey. The European Social Survey is conducted every 2 years since 2002. So it offers a lot of data on social topics, and we include always a health module every 7 years, I guess, but it also includes a general health questions, which we were able to analyze. Then we have Pronos, which is a sub-survey. It's a panel survey of the European Social Survey. We use the European Quality of Life Survey and the ISSP, the International Social Survey Program. And I want to talk about two health outcomes today. The first one is self-rated health, and the other one is mental health. Mental health was particularly measured in Kronos, where self-rated health will always refer to the European Social Survey. And I also would like to look at health behavior. And because I'm not able to cover all determinants that were included in the framework, I picked particular or examples of social determinants, and this includes, for example, social support and housing conditions. And I would like to start with self-rated health and health-related behavior. Using data from the ISSP, we found that overall the European population is doing okay. Europeans aged 15 to 34 overall reported better health than their older peers. This is good because sometimes we see that especially the younger generation doesn't have a good health anymore compared to the older generation, and that for university students, for example, the health is decreasing. But in the ISSP from 2021, we actually found that young Europeans are doing okay. However, we still see that around 14% of men and 15% of young women describe their health as poor or fair, so still a substantial number that doesn't live in good health. And I want to say that our reports focus primarily on young people, always in comparison to older people, but you will hear a lot from me about the younger generation in Europe. We do see notable differences by country. Again, this is data from the ISSP 2021, and we see that Hungary and Czech and Slovakia report the lowest rates of fair or poor rated health. This often at the first glance comes as a surprise, but this is actually a finding that we see a lot when we look at self-rated health. This is often due to cultural factors. We also see that, for example, Italy doesn't have a lot of people that report their health as poor or fair because these populations often tend to rate their health a bit better than it actually is. And we do see that, for example, in Denmark and France and Norway, the population usually reports their health as poor compared to the other countries. We also see a lot of differences in self-rated health by education. And this is one of the most important, maybe, social determinants of life. Education predicts health literacy. It predicts your earning incomes and your job opportunities in later life. So it's a very important determinant, and we always look at education when we look and differences in health. And we see that the lower educated groups usually report poorer health across all age groups, which you can see on the left, and across all gender, both male and female. Those with lower educational levels report poorer health compared to those with medium and higher education. We also see differences in health-related behavior, but unlike self-rated health, we actually see that it's more favorable for the younger generation. We see that daily smokers is actually quite low in, I don't want to say quite low, but it's lower than in the age group 35 to 54. So younger people smoke less. This we can see for both male and females, that people aged 15 to 34 have lower smoking rates than those aged 35 to 54. We also see not a similar trend, but we see that alcohol consumption is lower in the younger generations, but only for males. The female younger generation, 15 to 34, is shown on the lower bottom, actually drinks more than females aged 35 to 54. And coming to the next important measure of health in Europe, and that is mental health. And mental health is a state of mental well-being that enables people to cope with the stresses of life, realize their abilities, learn and work well, and contribute to their community. And again, this definition doesn't come from me, it comes from the WHO. And based on this definition, we included a question in the Chronos survey, the sub-survey of the European Social Survey, where we measured how the self-rated or subjective mental health is in young people in Europe. And we did so by asking respondents to rate their mental health on a scale from 1 to 5, with poor to with very good or very bad to very good. I have to say first that this is not a measurement of depressive symptoms. This was a fairly new item that we wanted to try and include. So this is really subjective mental health. We did not use a depression scale to measure depressive symptoms like the WHO 5 well-being index, but yeah, we measured subjective mental well-being. And that's why maybe when you come across other reports, you will see that the prevalence of depressive symptoms is much higher than what we report here. Anyhow, we found that among the Chronos respondents, nearly 7% reported bad or very bad mental health, and that the prevalence again varied substantially between countries, with respondents in the United Kingdom, Hungary, and Iceland reporting the highest proportions of poor mental health. We also see again differences by socio-demographic factor and especially by education. It is shown on the lower bottom, and we can see that those with a lower education were more likely to report poorer mental health compared to those in the higher educated groups. Compared to medium education and high education, those in the lower education, it's more than 30% that reported their mental health as fair to very bad. We also see differences by age, with younger people substantially more likely to report poorer mental health compared to those over 35. And we see differences by gender, with females more likely to report poorer mental health. This is a common finding. Females are usually more likely to confess that they struggle with their mental health compared to men. And it's also a common finding now that younger people rate their mental health poorer than older people. We looked at determinants that might be associated with mental health, and one that is particularly important is social support. And we can see that among those who received support, 94% reported good mental health, whereas 85.6% did not. So social support is an important factor that should be considered when we talk about interventions, and especially digitalization and isolation, that maybe we should increase again participating in community networks and increasing social support and social networks. And another very important topic that came up during the report and also to some of the presentations that we did, and that is loneliness. We used data from Chronos again to look at loneliness, and here the question was, have you felt lonely during the past week? And we found that 39% of respondents felt lonely during most parts of the week, and that young adults are overall lonelier than older adults. We can see in the figure on the right that around 52% feel at least moderately lonely, compared to 35% of older adults feeling lonely. And we again see differences by country, with respondents from Hungary reporting particularly high levels of loneliness, followed by Czechia and France, and lowest rates in Finland and Austria. So again, significant country differences that deserve further investigation of why people feel particularly lonely in Hungary, for example. We also looked at the association between loneliness and mental health, and we found that respondents who reported feeling lonely were more likely to report poor mental health. We see this across the different surveys. Here we used Kronos data again, but if you use other social surveys, we also see a link between loneliness and mental health. And another very important determinant is healthcare access. And in our reports, we looked at general healthcare access, and we looked using Kronos data again at healthcare access for mental health. And this figure shows data from the European Social Survey, from the 11th round of the European Social Surveys. And here respondents were asked if they experienced unmet medical needs in the last 12 months. And we have looked at this by gender and age. And we can see that younger adults were more likely to report unmet medical needs compared to older adults. We also see differences by gender, with females overall more likely to report unmet needs compared to males, and that we see for all age groups. We see similar patterns for mental health here. Again, we use the sub-survey of the European Social Survey, and we see significant differences by the socio-demographic factors. Younger people overall report higher rates of unmet mental health care need compared to older adults. Again, females have higher unmet health care needs, and again, those with a low education have higher unmet healthcare needs compared to those with higher education. We also see that, and this is again referring to general medical needs, unmet needs, is that women living in urban areas are more likely to report being unable to access care in the past year compared to men in urban areas. And one of our explanations is, for example, that in urban areas, and actually I thought this was surprising. I thought maybe the rural areas suffer more from unmet healthcare needs because it's more difficult maybe to get to the doctors. Especially in Germany, we see that there are not a lot of doctors' offices anymore in the rural areas. So I was surprised to see that it's actually the opposite, and people in urban areas are more likely to report unmet healthcare needs. But we think that this could be due to a greater demand in urban healthcare systems, and also potentially differing expectations and thresholds for seeking care. That in urban areas, especially young people are more likely to seek care, but then are faced with challenges to access the healthcare they need. But still, I think these results are very interesting and also deserve further investigation. And then another determinant that we barely discuss when we look at differences in health, or in general when we look at the social determinants of health, is housing problems. And first of all, it's important to say that adequate and safe housing is a key, what we call material determinant of health. We experienced it especially during the COVID-19 pandemic, that people in I don't want to say unsafe housing, but in that were crowded in houses had higher prevalence or higher incidence rates of developing COVID-19, whereas people in safe housing were able to to separate more, and so on. And we see that in the younger population, housing problems are pretty widespread, and we see this for both men and women. And we see this, yeah, it's quite clear that younger generations have more challenges in accessing safe housing. And with that, we mean, for example, rotten windows or damp walls, and so damp apartments, leaking roofs, flushing toilets, overcrowding, or non-functioning heating. And I recently came across a report from Germany that showed that especially university students suffer from poor housing, especially when it comes to their student housing. So this is an interesting finding, I think, looking at housing problems among the younger generation. And we know the rent market everywhere in Europe became extremely difficult for the younger generation. And we see again that the share of young adults facing housing problems varies widely across Europe. We see Croatia, Greece, and Italy at the lowest end, and the highest end are Germany, Iceland, and Belgium. We also see that Europeans in urban areas face difficulties, and like I already mentioned, we think that this may be due to unaffordable rental markets, especially in big cities. In Germany, for example, it became extremely difficult to pay for housing, but also less stable living arrangements, moving between towns, changing relationships, and so on, finishing your studies or your education, then having to move again and find new housing. And that was it from the reports. The reports are very lengthy, and we have done a lot of analysis also on the other social determinants of health. And I invite you to read them, and also to go a bit more on the reasoning of why we found certain findings, and yeah, to see what other differences and so in the social determinants across Europe we found, and in the health indicators. And now I give it back to Terje.
Thank you. And of course, this story that you just told us is quite concerning in some ways. I think that one of the key takeaways is that the new social divide in Europe is perhaps not our social status, education, or what we traditionally think of as the main dividers. I think the new divider is the generation gap. When you look at loneliness, for example, we see that the younger are more lonely than the older generations, and not to speak about mental health, where we also see this generation divide. So I think that's extremely concerning. I think we have also a slide here with some key takeaways, so you can also take note of them. So overall, we do see that most Europeans report good health, but I think that as long as there is a share of those who are not feeling well, then that's already concerning. And then again, we see that there are variations in who these people are. We have looked at some of the determinants, so basically the factors that explain these variations. And in this presentation, we have looked at social support, we have looked at housing conditions, we have looked at financial strain, and healthcare access. There are others. These were some of the, I think, most striking determinants that we've looked at during this project. And the fact that it's the younger generation that is at risk is just completely unacceptable, because usually, when we are young, we haven't really accumulated all the experiences that makes our health get worse, deteriorate, right? So we should expect that it's really at younger ages when we excel, but in this situation, it's not. For mental health, for loneliness, and that's very concerning. And we need to understand the mechanisms and the tools to deal with this. I was just looking at one of the results from Finland, for example, that the lower levels of loneliness in Finland, and that just reminds me of the stories we get every year that the Finns are the happiest in Europe. So now we can start seeing the connection. So this is one example of a project that one of the, if you're a student here listening, that you can look into using our data. We have also looked at behavior patterns, so smoking, alcohol consumption, diet, and BMI. These are usually referred to as the big four. And these patterns are themselves mixed, and they also help explain the broader the findings that we see. But they are in turn influenced by the wider socioeconomic conditions in which we live. So one of the typical advices that some people give to the younger generation might be stop drinking, stop smoking, start behaving. But basically, in the end, it's the conditions in which they live. It's their housing conditions. It's the healthcare access. It's the financial situation that in turn affects behavior. So that's why we need to look beyond behavior alone. Is there another slide here with conclusions? At least there is one more thing I wanted to mention before we start the discussion. Yes. So this is my kind of my last message for you. So this is a new project. It's not part of the Infra for Next Gen project, but it is a policy implication of the Infra for Next Gen project. So it does relate strongly. Because what we've seen today is that we have a new generation now that is growing up that we need to take care of because we see some really disturbing tendencies. And we don't only need better policies. We also sometimes we need better data, or not just better data. We need data where data previously did not exist. And one of the, this might surprise you because we do have data sources that is looking at the adult population. So European Social Survey, like 15-year-old or 18-year-old plus, kind of focusing on the working age and even into older age. We have the SHARE data, which looks at people who are older than 50. So we have all these surveys that are comparing countries at different life stages, but there is no single survey in Europe that is focusing on children and on children growing up. So when we are looking basically at the situation today and trying to explain why the younger are feeling as they are, why they are lonely and why they struggle with mental health issues, of course, you should start earlier on and see what is going on while they're growing up in different countries. So this is what the guide study will do. And what I'm going to say about that is that it has not started, but it was an initiative by the European Commission already more than 10 years ago. They wanted to find out, is it possible to follow up children in Europe in a cross national way, in a comparative way, and in a longitudinal way. So since 2016, the European Commission has sponsored, I think, 5 or 6 projects. There's even a new Horizon project that was recently funded, Guide Prep 2, which is now preparing a guide for implementation. And indeed, there is a study called "Growing Up in Ireland." There are studies in separate countries, but there is no harmonized one. But actually, the study is coordinated from Ireland. and from the UK. So Ireland is a key country that is really driving this change, I'd say. So Sinead Sloan from the School of Education, University College Dublin, she's co-leading this with Gary Pollock from Manchester Metropolitan University. And my role in this is basically to secure funding in Norway, because now we are researchers all over Europe trying to find funding for this study. It's going to be extremely expensive within each country, but we just have to do it. Sometimes it's just too important. And I think the Infra Foreign Exchange project has shown how important it is to focus on the younger generation now to understand what it means to grow up. What does neighborhoods mean? School, family. On the next slide, you'd see some, please, if the this shows that it's designed by children themselves and policymakers and scientists. But a couple of more slides. Let's see, one more. Here are the questions. So we ask about the same things that we ask in the Infra Foreign Exchange project. So about psychological well-being, neighborhoods, schools, material conditions, activities, and we also ask their parents. So on the very last slide, let's see, one more, two, there, yeah, this is the last one. This is the last one. We are going to start in 2028. We are going to follow up 5,000 newborns and 4,000 eight-year-olds in the smaller countries, and double the sample size in the bigger countries, and follow them up until 2056. So you can imagine this is a huge study. And one of the main things we will look at is the digital environment in which children are growing up. And the digital environment is also very important in the Infra Foreign Exchange project. And what we have seen from the Infra Foreign Exchange project is that there is a relationship between usage of social media devices and how young people are experiencing bullying online and how their mental health situation is. And this is another idea for a project. So I think that the Infra Foreign Exchange project has been really innovative in this respect. But we need to understand how it is to grow up from the beginning, and what cross-national evidence is enabling us to do is to compare countries where social media is banned until a certain age with other countries. And we can also look at natural experiments, because some countries are banning now as we go, and we can see if this will change the situation. So guide study is the next big thing, and I would encourage everyone here to check if who is coordinating guide in your country, and please support them, because this is something as a researchers we just invest time in. It's just too important to ignore, and it's really the Infra Foreign Exchange project that has increased the relevance of such a study and an important policy implication of the Infra Foreign Exchange project. So that's my final policy message.
I'm David Consolazio from the University of Milan. First of all, thank you for being here. I'm also a researcher in the field of health inequalities. I would define myself a social epidemiologist, but today I'm here with another identity because I'm a research fellow on the Infra Foreign Exchange project, and in particular in the EVS side, European Body Studies. So together with Ruxandra and Julia, who's not here today with us, but is working hard on this project. We are all working on together. So we are supporting the project, the Infra Foreign Exchange project. And I will give you a more technical presentation about the data sources and the tools that you can use to answer your question, in this case about health inequalities and health topic in general, but the data sets and the tools that I will show you today will be useful for any other pillar of the Next Generation EU program. So all the issues that have been covering the Infra for Next Gen, and even beyond. So even if you have other research questions, I'm sure that you can find something useful. So the project is built around the five major European cross-national survey infrastructure, which are the European Social Survey, that is the leader of the Infra from Region project, the European Body Study, which is represented by me, Gender and Generation Surveys, and then we have also the HITSP, which has been mentioned several times today, and the EQLS, the European Quality of Life Survey. For a reason of time, we will focus on the first three, so the ESS, EDS, and GGS today, and plus we will talk, but Ruxandra will do that. We'll talk a lot about Kronos, that's still part of ESS, but is a different thing, and it has been really mentioned several times also Kronos today, but Ruxandra will deepen the knowledge about this survey infrastructure, and I promise that there will be a lot of news for you today. So first of all, you might ask yourself why these surveys matter, and it is because they ensure coordination and comparability, as we just saw regarding the health pillars, and they allow for repeated cross-sectional design and sometimes even longitudinal design. They follow the high methodological standards, the highest methodological standard, because in principle now with internet communication technology, everyone is able to prepare a survey and to spread it all around the web, but to let's say build, prepare, and get the answer uh, from a high quality survey is another thing, and this survey infrastructure exactly do that. And all the data are shared in the form of open data. So you just need a login, a free login with any of your like Google account or something similar to download the data. And they are essential for social science research and policy analysis. So I would say that they are quite interesting. We I will go very quickly to three of them. So the ESS provides high quality open data um, measuring about, sorry, they provide high quality open data measuring public attitudes, beliefs, and behaviors. So it's about survey data gathered at the individual level, and then of course you can aggregate your analysis at the country level, also other intermediate unit of analysis, but they are gathered at the individual level. It's about European countries, cross-sectional, made mostly of face-to-face interviews with some exceptions during the COVID pandemic. And the project started in 2002, and every 2 years we have a new wave. So we have 11 waves so far, and again, it's all freely available on the internet in the format of open data. In this map, you can see that nearly every European country has been part of the ESS in a round or more. In the green color in the map, you find countries that have participated to all the 11 rounds, but you can see that in general, the ESS has been delivered throughout the whole Europe, more or less. And what is the topic of the ESF? So the main focus is about social and political attitudes, trust in institutions, democracy, immigration, welfare attitudes, and well-being. But the distinctive trait is that there is, in every wave, there is a core module, so a set of questions that are repeated every wave in identical or more or less identical form. That there could be some minor adjustment, but there are rotating modules. So every 2 years, this fixed part is accompanied by a more flexible part, this rotating module, which allows to cover aspects that might be particularly relevant in a given time. And so these characteristics provide flexible shape to the server infrastructure. For instance, go out from the presentation a bit, because I want to show you that in the latest wave, the 11th wave, but also in the 7th wave, so in ESS7, ESS11, we have a rotated module specifically focused on social inequalities in health. And here you can see all the answers that have been asked, sorry, all the questions that have been asked in wave 7 and wave 11. Most of them you see have been repeated, so you can make temporal comparison, and it is exactly the meaning of having these rotating modules. And these questions are all about the topics that Insa and Terje presented. This is just an example, but there are a lot of other rotating modules that you can find on the ESS website. So go back to the presentation and talk a bit about the European Value Studies. That is the most ancient cross-national survey infrastructure in Europe. It started in 1981, but it is conducted every 9 years. And so far we have 5 waves, and the new one is fielding right now. So we are asking questions in European countries in this exact moment, probably. It is a large professional survey at the ESS, but the focus is different because it's on values and cultural change, and again, open data. Also, the EVS has been delivered throughout all Europe. We reached the peak of 47 countries in 2008. Now, in the latest wave, 2017, the number lowered a bit to 37, but still relevant. And we are more or less at the same number for the new wave that is ongoing. But again, in general, every European country has participated at least to one of the EBS wave. And the focus is quite different compared to the ESS because it's about religion, family values, work ethics, morality, political culture, social norms. So the distinctive trait is that it is focused on long-term value change, and this is the reason why it is delivered every 9 years because social and cultural change is slow in its onset, so we don't need to ask the same questions every 2 years. 9 years is enough, and yeah. So the main focus is on these cultural and normative dimensions. So it is fundamental for the study of deep social and cultural change. And then we have the GGS that is longitudinal instead. So it is different in its structure compared to the ESS and EDF that are cross-sectional. And the focus is also different because it's about demographic behavior mostly, family and life course dynamics, but again, open data. As you can see, it's not only about Europe. Europe has a quite extensive coverage, but some Asian countries and South American countries and also Australia is covered. The first wave took place in 2004, and then we have 2 waves with two rounds with different waves. Being a longitudinal study, the same individual, the same persons are interviewed again and again. So it is possible to have to study not only the cross-country differences, but also the within individual differences. And the main focus, again, is completely different compared to ESS and EDS because it's about demography, so strategic intentions and behaviors, partnership formation and dissolution, intergenerational relationship, work-family balance, gender roles, and so on. So the distinctive trait is that it allows for the possibility to study life course perspective in a dynamic way, thanks to the longitudinal design and to focus on micro-level demographic processes. And it is tailored for the study, again, for familiar and demographic dynamics. And this is just a table with a summary. So if later on you need to edit more, a more condensed view of these differences, commonalities and differences between the three serving infrastructure, you have it here. And in general, you might ask yourself, so what? When to use which one? And in general, you might want to use the ESS when you're interested in studying trust, democracy, welfare attitudes, and when you want to compare countries on political attitudes. And the EDS instead is better if you want to study these long-term value change and your topic are religion, morality, norms, cultural transformations in general, and the UGS in general when you want to study fertility, partnerships, life course transitions, intergenerational relations, and so on. And I put some examples of some hypotheses or research questions that it is possible to answer with each of these survey infrastructure. But the most important thing to highlight is that these infrastructure are complementary rather than competing. So they are not competitor in a let's say, private market. They are complementary, and indeed, this is exactly what the Infra for Next Gen project aims to. So to put all these server infrastructure, not only ESF, EDF, and GDF, but also other existing infrastructure, and to make them communicate each other, so to complement each other, because there are some commonalities, so some questions that have been repeated throughout these questionnaires, or some other that can enlarge the spectrum of analysis, of possibility of analysis. So the idea is to empower these software, these sources. And we have been doing this in several ways. So the first one is that we build this inventory of survey items about the ESS, EDF, GGS, ISSP, EQNS, and the Eurobarometer and Chronos as well. So basically, open the tool, sorry, it is freely available on the Info for Next Gen website. The issue is that when you want to start your analysis in general, the first thing you have to do is knowing where you can get the questions, so the data. And as you can see, there are a lot of sources, and it might be challenging at the beginning, especially if you are at the beginning of your career as a researcher, to understand where the questions that you need are, when they have been asked, if they have been repeated or not, and so on and so forth. And you have to go to each website, to each survey website, and to download a different PDF file with the questionnaires, and to move across between them, and it might be complicated. So the idea was, why don't we make this inventory? Why don't we put all the questions that are relevant to one or more of the five pillar of the next generation EU, so make it strong, healthy, equal, digital, and green, and put all together in a spreadsheet so that people can navigate them with some feature. Don't need to go to different web environment anymore. Why don't we centralize everything in a single tool? And we did it. And so you can see that it is just an Excel spreadsheet that has been uploaded online in a nice way. And here, if you open, you have all the questions, but of course, the nice thing is that you can navigate it with these features. So for instance, I can filter for all the Make It Healthy pillar, and in an instant, I get all the questions that have been asked in all these survey infrastructure regarding health. So there has been a manual check by me, Julia, and Ruxandra. So every question has been read, and it has flagged or not as relevant for any of the pillar. And so you can see all the health-related questions, but you can also search by keyword, and you can do it independently or combine to these other filters. So for instance, I want questions about smoking. I just type smoking, and here in an instant, these are filtered. And again, I can select also the pillar. And suppose that I know in advance that I want to work exclusively with some survey, to say the ESS and Chronos. I can filter the survey as well and the year. So suppose that I'm interested in focus on recent waves, I can select them and filter. So it's very easy. You can also download not the actual data, the data set. To do that, you have to go back to the server website, but you can download the Excel spreadsheet. So you can export this view that you have here and save it on your local machine. And the keyword work also with a Boolean operator. So you might want to write and be your own specific keyword. So it's very simple to use. Just play around, and you can see that you have some settings to explore. But again, it's very intuitive. So just go there and play with it, and I'm pretty sure that it can be very interesting and useful for your upcoming analysis. Then, oh yeah, this is just a table with the numbers. So you can see that, for instance, for the healthy, we had in total 2,300 items, questions, 1,450 of which comes for the Eurobarometer, and the remaining are from the most from the 5 survey infrastructure. And in general, we see that we have almost 11,000 items. And this is the link again. Oh yeah, I already talked about this, the issue and the task. So what is the inventory? Another thing is Gazi search. So other survey infrastructure are present in the Gazi search. For instance, if you want to download the European values study, you have to go to this website. The Gazi is the German institution for archiving social science data, and there's a lot of information both from the major surveys like EDS and ICT. You can see that you can download the data sets here, but also from minor studies. So if you have kind of local project in your university and you want to make your data available, you can do it in this archive. So you can find a lot of other um, data, and you can also search by keyword. So I never did that about health behaviors, but let's try. Suppose you want to find something about health behaviors. Here you can see you can filter the research data or directly the variables. You see which health behaviors are mentioned. So it is another compressive tool that might be of interest for search about information on the topic you want to analyze. Again, very intuitive, easy to use, so you just go there and play around. Another thing is the e-value tool that basically it is a way to visualize the value, the data of the European values study in this interactive way. So instead of downloading the data and make your own analysis with your statistical software, you can see the geographical distribution of some key indicators already online without needing to have a basic quantitative statistical analysis or in general in territorial analysis. And this is about the EVS only, the e-value, but such software, such tool was so much appreciated. Yeah, sorry, I'm going back and forth the slides. That in the context, yeah, sorry, I lost, yeah. In the context of the Infra for Next Gen project, we decided to develop an eNext Gen tool that is basically the same, but not limited to the European value study, but covering all the survey infrastructure that we are talking about. So the project was expanded, but the logic is the same. You select a question that is of interest for you. So now is in work in progress. So it will be populated with other variables, but just to pick one randomly, you can see if like the percentage of tension between old and young people in Europe, and you can stratify your analysis by gender, age, educational level, rural urban dimensions, or a combination of them. And you can also have a keyword search, and these slider allow you to move between different years. And if you click on compare map, the screen is split between two maps, and so you can compare, for instance, the same indicator between men and women or different years, and so on and so forth. Again, everything is made with with intention to be easily navigatable. In particular, this tool has been developed for didactic purposes. It is used a lot in secondary, upper secondary, and also lower secondary school by teacher to show basic information at an aggregate level, but nonetheless, it can be useful also for more advanced purposes. Oh yeah, and there is also the possibility to explore the data in a traditional format, not in math. You just need to click on explore, and you see that you have this graph with the percentage and the flags. So other ways to visualize the data. And then, yeah, the last one I will show you is the GGS teaching data set. So probably not useful already today for your later assignments today, but if you want to start working on with longitudinal data, you know that especially if you are at the beginning of your career as a researcher, uh, working with longitudinal data is a bit difficult, or at least more complicated than working with a cross-sectional data set, because you have to organize your data set in a certain form and move from long to wide data set. You have repeated observation for the same individual and so on and so forth. And sometimes it's difficult, again, to organize the data set. But the GGS made a couple of teaching data set indeed that have been prepared exactly for these purposes, to start learning how to work with such kind of data. And in particular, there is a starter data set and an advanced data set with more variables, more complicated, and they are provided in SPSS, data, and Excel format. And so they are very interesting if you want to not only to start to learn, but with the advanced data set, I guess that you can also make some analysis that can be potentially published on an academic journal. And there are a couple of tutorials, video tutorials, and again, the data sets that you can download, and these topics about more graphic topics about fertility intention and so on and so forth. You see that cover also the health topic, because we have the module on well-being, mental health, happiness, loneliness. So if you are interested in social inequalities of health in general, it is a very useful resources. I guess I finished my part. So my suggestion for today is that you can use these tools, which are all here. And start, yeah, to search for the questions that you might want to be used in your assignment later on in this workshop, unless you know the data very well because you work with them in the past. It's a nice way to start exploring them, and Ruxandra will also show you how to use another tool that is the online data portal called the ESS and Kronos data.
And we are back now for the second session, and here we'll cover the infra for next generation data. So everything that we've talked about, that Terje and Insa described, I'll tell you where you can find it and a bit more background information about that. And then we'll hear from our experts, policy experts from the Joint Research Center of the European Commission. And we'll have some time for questions if there are any. So, sorry, let me see. My computer just decided to freeze. No? Okay, this is it. My name is Ruxandra Comănaru. As I said earlier, I work for the European Social Survey, and I will tell you a bit about the data. So the data for this project comes from the cross-national online survey, Kronos, online first survey, because it's not just an online survey. And this is a web panel, web and paper panel with respondents recruited from the European Social Survey. The survey data is collected at the individual level in various European countries. It is a cross-sectional and has some elements of longitudinal data as well. And so Kronos has had various iterations for the past 10 years. Kronos 1 and Kronos 3 include offline populations, while Kronos 2 focused only on online populations. So in Kronos 1, we experimented a little bit with giving participants tablets that could connect to the internet for the duration of the project, for them to fill out the surveys. While in Kronos 3, we are using both online questionnaires and paper as well. the data is open and available to use for non-commercial purposes. So the ESS is a repeated cross-sectional survey. This is the European Social Survey. The sample changes in each wave. So every 2 years, we collect new data with new fresh sample of participants. And some questions are repeated. So this is the core module. It's a lot of questions are repeated in every wave of the European Social Survey, while other questions differ. These are the rotating modules, which are selected 2 rotating modules in each wave from different kind of social research areas. And sometimes these ones are repeated as well, but not all of the questions. So let's say maybe half of the questions, 10, 15 questions are repeated, while others are new ones. The temporal changes here can be tracked at the aggregate level. The Kronos panel is a cross-sectional panel where respondents are recruited from the ESS and are interviewed again in subsequent waves. There are different questions introduced in each wave, and there are some longitudinal component modules, especially on Kronos 2. And the great part about the Kronos panel is that because it recruits from the parent ESS survey, the data can be linked back to the ESS questions. So it's not yet a longitudinal panel, but we are now working on the next iteration of Kronos, hopefully soon, where there will be a longitudinal kind of set of questions that will be repeated at every wave. So Kronos 3, the Kronos that was repurposed to work for Infra for Next Gen project, supports this project as well as another one, the So Green project, led by our colleagues at Share. And it takes place in 11 countries. It is an input harmonized and centrally administered survey, panel survey, with respondents recruited from ESS 10 and 11. It uses a mixed mode approach with web and paper self-completion questionnaires, where panelists are 18 years and older. And so far we have 8 waves in total. We're in the field with a 7th wave, and 5 of these waves were part of the Infra for Next Gen project. So this is a little bit what I was saying about the different iterations of Kronos to date. So the first one was a pilot, recruiting participants from ESS 8. The second one recruited participants from ESS 10, which was our pandemic run. This is how we call it. That's why the Kronos panel was online only, because we couldn't recruit people who were offline during the pandemic. And that one had cross-national waves and also country-specific waves. And Kronos 3 is the one that supports the Next Gen EU themes: green, digital, healthy, strong, and equal, as well as the So Green project. So the cross-national survey 3, the Kronos 3 panel, includes 5 different waves of data collection, and each wave has 90 questions. About 18 questions per wave were for each one of the themes of the Next Gen EU area. So that means that in total we have almost 100 questions for each one of the themes. So for health, for example, you have 18 in the first wave, 18 in the second, and so on till the 5th wave. The questions were developed by the Kronos team, academic and JRC experts together. We work to ensure that they are relevant both in terms of academic output as well as policy use. Some of the items were newly developed items, but other ones were used questions from existing surveys from different European research infrastructures. The countries that fielded and continue to field the ESS3 panel are Austria, Belgium, Czechia, Finland, France, Hungary, Iceland, Poland, Portugal, Slovenia, and the UK. So these countries, basically, we recommend doing cross-national analysis with this data, also because at times, when you get to quite smaller questions, the questions that are more relevant for a smaller sample, you might not have enough power to compare, to do analysis at a national level. So this is how recruitment is done. So basically in ESS round 10, we recruited participants from Kronos 2. We found that they were quite engaged, and so we transferred them to Kronos 3 and also added new recruited participants from ESS round 11. So Kronos 3 participants are basically participants that are recruited from both of these rounds. Some of them have been on the panel for about 15 waves already. The fieldwork period for Infra for Next Gen waves, it started in 2024. So as I said, our project started about 2 years ago. We started with a lot of energy to kind of gather all of these questions together, to put them in a format in which they can be asked of European respondents. And so in September, we ran the first wave of data collection and continue to do so until June 2025. So about a year ago, we finished data collection for Infra for Next Gen. The data was published a few months after it was collected. And so we have all 5 waves of data available. But also from the website, you can download a file with all of the waves combined. In terms of panel loyalty, so this is a graph showing the percentage of panelists who completed all 5 waves of Infra for Next Gen over the percentage of active panelists. And we define an active panelist as those that stayed in at least one wave. So as you can see from this graph, our panel loyalty is quite high in the Kronos panel. It varies from maybe 45% in France to over 73% in Slovenia and Czechia. And they are quite engaged even now. We're in the 7th wave of data collection. They're still quite engaged in responding to our questions. So the Kronos panel tries to ensure representativeness by including both online and offline populations. So we use paper questionnaires, and the offline population is identified in the main stage ESS using a variable that we call net use oft, basically asking participants how often do they use the internet on different devices, whether for work or personal use. So the ones who answer every day, most days, and a few times a week are automatically placed in the web respondents category. And those who say that they never use the internet, they are immediately put on in the paper response group. However, those participants who say they only occasionally use paper, they are allowed basically to choose at the first wave data collection whether they prefer web or paper. With regards to response rate, so I already mentioned that the panel loyalty is quite high. We also have a very good overall response rate for all of the waves. I think in total it's about 60% response rate, including web and paper responses. As you see from this graph, there were some hiccups in the first waves. We started a bit slow in some countries, but this picked up from the second wave on and continued to stay quite high. So it's all of it. I mean, a lot of it is due to the national teams who work on collecting the data, who are very engaged with the project, and they have tried to maximize the response rates as much as possible, sometimes even calling respondents to get them to take part in the survey. And as you see today, our team for each one of the pillars is quite large. We bring together academic experts, the Kronos team and research fellows, so David, myself, and Julia, as well as the Joint Research Center experts. And we all try to work together to bring to ask the right questions for each one of the pillars. So we work together to construct and fill the survey items for Kronos 3. And in terms of questionnaire, this is an overview of the questionnaire content for the 5 waves of Infra for Next Gen. As you see, it's quite a lot of different topics were covered, and we encourage you to explore this data. There's a lot of interesting things that can be found there. We've also run a couple of methodological experiments, some vignette experiments in wave 4 and 5, and those can be explored as well. So the green equals strong, digital, and healthy items have an equal space on the project. And as we've discussed earlier with Terje and Insa, there's quite a lot of things that we can look at across the different waves. So if you download the data, you can explore it by combining the different pillars as well. For the Make It Healthy topics, as you see from here, there are very different themes that were covered. So we looked a lot in the first wave. We checked out the access to healthcare topics, so access to GPs, to general practitioners, so like family medicine, to dentists, to specialist healthcare, mental health, but also we asked about hospital experiences. In wave 2, we explored health and the internet, so different services, information, and mental health. We looked at people's kind of use of unprescribed medicine, as well as leftover antibiotics, medicine use, and also we looked at some of the cancer risks. In wave 3, we asked people to self-assess their health, both mental and physical health. We asked them about different health problems and health in the workplace. While in wave 4, we looked at different commercial determinants of health, like alcohol, cigarettes, high-calorie snacks, but also health behaviors, alcohol, cigarettes, and snacks. So you can look at the determinants of health as well as the behaviors. And I think Insa already discussed some of this a bit earlier. And lastly, in wave 5, we looked at private mental health access, the cost of healthcare, exercising behavior, and other mental health issues that people might have. Sorry. Okay. So where is all of this data? We have a lot of data, and a lot of it can be downloaded from the European Social Survey website. And I will give you a demonstration to show you exactly where all of the data is. You can also explore the Kronos data online. And again, I will show you how to do this in a second, how to do this on the website. You can use the variable viewer to kind of give you some univariate distributions, or you can use the analysis tool online, where you add 2 different questions and can look at bivariate distributions. You can explore the data by theme, to look at the different indicators organized by the Next Generation EU pillars. But again, very important to remember that when we look at different waves, different rounds of ESS, so ESS 1 and ESS 2, for example, when we download the data, because this is cross-sectional data, if we want to merge it together, we get kind of like a larger data set. But if we look at participants in Kronos waves, we can merge them. We can look at the different waves, like across the waves, but also we can merge it back to their ESS round 10 and 11 responses. So this is quite a valuable tool that you can use. So it's more like kind of a longitudinal approach. There are useful documents online. There are the user guides for Kronos 3, there's a guide for weighting, and we recommend, of course, using weights. But now let me just quickly show you how to do this online. So here we are. Let me just go back to the ESS, actually. So this is the European Social Survey landing webpage. If you click at the top, in the middle, there's a data button. Click on that one. It will take you to the ESS data portal, and you click on this, and it redirects, as you can see, to CICT. CICT is our data archive, our colleagues in Norway who archive and process all of the data that we produce. So this is the data portal. You can search for different variables here. So let's say mental health. And then you get a list of the different results of different mental health questions that have been asked both in ESS and Kronos and all of the other kind of related projects. You can look at the different publication years, so kind of restrict your search and maybe also select the ESS and Kronos and see what you have. But another way to do this, sorry, data portal, is to go straight to the Kronos data. So when you click on that, you get the 3 different iterations of Kronos. The one that is of interest now for the Next Gen Youth themes is Kronos 3. So here you are. And here you have a breakdown of the Kronos 3 data by the different waves. So going from wave 1 to wave 5, these are the infra for Next Gen waves. Wave 6 is a so green wave, so it's more focused on the green transition. If you click on any of them, you can either go to the main data set or you can get the study documentation where you can read a little bit about the particular wave, the contributors, sorry, these are all of our academic experts for all of the pillars. And all of the other people who have worked on it, including the national coordinators, as well as the publication date. Here you have issues like kind of information about data access, the universe and scope, basically when the data was collected, what was the time period, the geographical unit. Here are the different fieldwork documents, the source questionnaires, the different national versions. If you're interested in the translated versions, you can find them here, as well as the letters to the respondents, a user guide, and the code book. And here you can find the different data country documentation. So again, the fieldwork period is the same. The data was collected exactly the same time in all of the different countries, the response rates per country, as well as the case count, right? Now, if we browse by country, you can see that all of the countries took part in all of the waves to date. Sorry. And you can explore also the data by theme. So here you can find the Make It Healthy data. It's the first 5 waves. Once you click on it, you get an overview of all of the questions when they were asked in each one of the waves, right? So this is all of the questions for health. And let's say if we look, let's say for mental health. Okay, this doesn't seem to work. Sorry about, oh no, it did, sorry. So you end up with 16 variables and you can see how they've been asked in different waves. And the different questions that are asked here. So clicking on the little arrow takes you to the variable viewer. So for example, subjective mental health. In general, the question was, how is your mental health in general? And here you get an overview, a breakdown by countries on the different responses that participants gave to the mental health question, ranging from very good to very bad. And you can see the comparison between different countries. There's also a map that can be explored. This tool is particularly interesting if you just want to explore the data a little bit before you decide what you want to download. You can also do a bit of analysis. So let's see the subjective mental health data. And let's see the other variables in Make It Healthy. Maybe we could ask something about work. So how often your job involves weekend work within the usual schedule, maybe, or worked outside the usual schedule. Let's see this one. So again, a brief overview of an analysis by country of mental health in general, by working outside the usual schedule over the last 4 weeks. So again, you can see the country differences. You can look at the individual countries' breakdowns and explore the data like that. And here you have the different questions and variables that were asked. So I encourage you to have a look at the data to try to see what analysis can be done, what are the different variables that can be used, and so on. You can use this button here to download the data. And here is the citation as well. So how to cite the data. So just a bit of a recap. So you go to the CESSDA portal, select the cross-national survey Kronos, and we're interested in Kronos 3. And you can browse by wave, by country, or by theme, downloading the data files by theme to cover all of the waves, or all the waves and all of the themes. The different formats that can be used to download the data are CSV, SPSS, or Stata. And here is the Make It Healthy pillar. You can use the variable viewer. As I said, you just look for one of the variables that you're interested in, and then it runs a quick analysis, descriptive kind of univariate analysis of the results. Or you can use the online analysis tool, so comparing the different questions and variables, and this is what you would get by using this tool. So this allows you to just play a little bit with the data before you decide exactly what you want to download and what you want to look at in more depth, maybe. Or if your maybe statistical skills are not so developed, you can definitely use this. All of the graphs can be shared easily. They can be downloaded and shared on social media if you want, or in reports. So we encourage you to explore that.
I'm Celia Burgaz. I work in the European Commission Knowledge Center on Cancer, which is a platform I'm going to be talking about today. And I'm the one that is in charge of managing it. And I'm going to explain you a little bit the role of the Joint Research Center, that is one of the directorates of the European Commission. We do science for policy, and we are going both me and my colleague Francisco, we are going to explain to you how we are actually supporting policies with evidence. So,
Celia, if you don't mind, could you lower the Zoom windows, because it's now the gray screens visible?
Yeah, sure. Let me try like that. Does it work better?
It's still there. I think you can go and minimize the... Yeah, now it's better. Thank you.
I don't know if that works now, that I can no longer see. It was the problem of seeing the faces of the different people, right? Now it
I
works?
think it's okay. It's just a bit of a gray in there. It's okay. Please go ahead. Thank you.
A bit of gray. I cannot see that in my screen, so I'm not sure I understand what you are referring to.
It's the Zoom settings that you're sharing, then it's overcoming the text, but I think now it's really just a small amount, so please go ahead.
What about now?
Now it's better. Yeah, thank you.
Okay. Yeah. Well, you tell me, because I just simply minimized so that now I can no longer see the speakers. But for the rest, I didn't do much. So,
thank you.
Well, I'll go back to the previous slide. Here it goes. So, the Knowledge Center on Cancer started as a flagship initiative of Europe's Beating Cancer Plan that was officially launched some years ago in 2021. because they realized that the numbers of cancer in Europe in 2020 and the years before were very dramatic, and that something needed to be done, but a more holistic approach from prevention to early detection and screening to quality of life. And because of that, they created the Europe Speeding Cancer Plan. It was launched in 2021, and it was composed of 10 different flagship initiatives covering the whole cancer pathway. So as you can see, the first flagship initiative is the Knowledge Center on Cancer. There are many others. I'm going to talk a little bit about also the cancer initiative on screening schemes. And then my colleague Francisco is going to be talking about the European Cancer Inequalities Registry more in detail. So what is the Knowledge Center on Cancer, and what does it mean that it's a flagship initiative? It's basically the idea of the Knowledge Center on Cancer is to complement all of the activities that we are doing at the European Commission together with the Director General for Health and Food Safety, so DG Sante, and also the Research and Innovation one, RTD. And it coordinates all of the activities that we are doing at the JRC in the field of cancer and aligns. The nice thing is that in order to make sure that we are not reinventing the wheel and that we are working in the same direction, we also make sure that we are aligned with all of the different activities on cancer by the whole European Commission. So we are constantly in touch with different departments working from the research perspective or from the health perspective, making sure that the legislation is aligned. So it's all of the source of knowledge that we are producing at the JRC, and it's also a very useful source of reliable evidence for research and policy making. So you can see in this image that is composed on 5 different pillars. The first one is the European Cancer Information System, which basically provides a lot of statistics on estimates of mortality and incidence on cancer, and it's a great way to see the burden of cancer across all the European countries and to also see the progress that has been made over the years. Then we have the second pillar, that is the one on health promotion and disease prevention. This is very useful for policymakers who want to have sources of reliable information available for specific topics. It can be related to specifically non-communicable diseases or also risk factors. So, for instance, if you're interested in understanding topics related to cancer prevention, you can go there and there is a lot of evidence available that is based on science, but we also have specific information if you're interested in understanding tobacco or alcohol or other risk factors. We also have a part on mental health, and the nice thing about this health promotion and disease prevention knowledge gateway is that it's not only focused on cancer, but it has information across different non-communicable diseases, so it can be really useful. Then we have the European Guidelines and Quality Assurance Scheme pillar, which is very important because this provides cancer screening guidelines for the most common types of cancer. I will explain that a little bit in detail now. And it provides quality assurance schemes that are voluntary and then can be implemented either at local, at regional, or at national level. Then there is also work that we are doing on rare diseases. My colleague Francisco is going to also talk about this part, so I won't go too much into detail. But this is part of the Knowledge Center on Cancer because every rare disease among children or pediatric ages is considered a rare. Every cancer disease is considered a rare disease. So that's why it's also part of this pillar. And then we have the European Cancer Inequalities Registry, that it's combined in a way with the data that we are providing with the European Cancer Information System, which is the first pillar, but looking at it through the lenses of inequalities. So we are able to see how cancer inequalities are developing and progressing around Europe, and we do it through numbers. But well, my colleague Fran is going to explain that in detail as he's the master of it. So, because we do a lot of different activities in the Knowledge Center on Cancer, I wanted to first and foremost stress that you can stay updated on all the things that we are doing, because we have different pillars with different types of output that is being produced. So we have the part of research and data that is available for you to use for research purposes. But then there is also parts related to more advocacy or evidence-based policy briefs. So we really recommend you to sign up to our newsletter. We publish it every 2 months, and it has both scientific updates relevant for cancer and also non-communicable diseases, so not just cancer. Then policy news that are relevant both for the Commission and outside. Then different calls for grants, that is very important. We are publishing every call for grant that is related to the field of cancer and other non-communicable diseases. And we also include different European events, conferences, and also vacancies. So if you scan this QR code, you will be taken directly to the link. Otherwise, I will share it in the chat, how to register properly through the website of the Knowledge Center on Cancer. And now I'm just going to, because I still have some time, I'm going to go a little bit more in detail in some of the pillars that I described that we think can be interesting for you to know. So the first one is the European Cancer Information System. That is the one I was telling you about, that allows us to see and to measure through data the burden of cancer across the European Union. And it actually has more countries that are 32 in total. It's a lot of work to coordinate all of this because it provides standardized data from over 125 registries across Europe, because some countries have registries at regional level, and all of this information is to then be translated into European. And of course, the purpose of this is very simple. You cannot manage what you cannot measure. So first and foremost, we need to measure how is the burden of cancer in Europe in order to provide evidence for policymakers to design good policies that are going to tackle this, and also to see if the policies that are already in place are actually working. And it lets us see through this data that we have geographical patterns, so we can compare between countries and within countries. And also it allows us to see the trends over time in the incidence, prevalence, mortality, and survival, which is very important to understand. For instance, how has cancer progressed ever since 2020. So if you go to the website, you will see that they have different types of information available. There is, of course, the Data Explorer, which is constantly being updated. Right now, we already have the 2024 estimates, so it's even more information than the one that you can see in the screen. Then we also have the long-term estimates based on the numbers that we have now, how we see that the estimates of the incidence and the mortality of cancer in Europe will be by 2040. And we have other type of information if you are interested, for instance, in childhood data or in prevalence estimates. And on top of that, in order to translate all of this data, we also have specific fact sheets for different types of cancer. So there is, for instance, for liver cancer or for breast, but also other information for the aging population. So I will invite you to check the website of EKIS that you can see actually in this link below. Then another pillar that I mentioned before is the one related to health promotion and disease prevention. That is for non-communicable diseases in general. So it's really not only specific for cancer. And as I said, it's a reference point for public health policy makers, because we make sure that the information provided there is evidence-based and taken only from scientific sources. And you can have different type of information there, from mental health to prevention of non-communicable diseases. We also have a part on food systems, the other risk factors of non-communicable diseases, such as what I was saying before of salt intake, tobacco, alcohol, and then also societal impacts of the non-communicable diseases. So it's really a lot of information there. Then we also have the third pillar, and with this one I'm going to stop, and then I will of course give the floor to my colleague Francisco. But we have this pillar of the European Commission initiatives on cancer screening and care that I wanted to explain to all of you, because there is a lot of work going on here. And of course, our goal is very simple, is to provide quality standards for cancer care services across Europe, to make sure that the discrepancies that we are seeing across Europe in both prevention and quality of care and access to care are tackled, and that it doesn't matter in which country you are in, you will have good quality standards for cancer. So we have this information for, as I said before, the 6 more common types of cancer in Europe, which are breast cancer, cervical cancer, colorectal cancer, gastric cancer, lung cancer, and prostate cancer. For the breast cancer, we already have all of the information that is published, so guidelines and quality assurance schemes, and now we are working in the other ones. And this is really a source of very useful information for patients, but also for healthcare professionals across member states, and of course for policymakers. I'm leaving the link below so that you can have a look at the specific website on this. And just to tell you that there are 2 ways in which it's working. We make sure that we have evidence-based guidelines for primary prevention, screening, and diagnosis, that is the first part of the whole process. And then we collect also international guidelines in the part of treatment, rehabilitation, follow-up, survivorship, and also palliative care. And that's the quality assurance scheme that is really covering the entire cancer pathway. And this process is done for all the 6 types of cancer that I showed you before. This is very important because thanks to this, we can provide quality standards for cancer services, as I said, across Europe, making sure that this inequalities gap is fixed. And it also takes into account, through the methodology that we are using, pension-centered values, because we make sure that part of the process for the quality assurance scheme and the guidelines involves not only scientific experts, but also patients and caregivers. And it's a voluntary scheme, so it allows for a stepwise certification approach, and it understands, so it's quite flexible about the infrastructure diversity that we have across European countries. So this is my last slide. What can you do with all of this information? Well, first and foremost, help spread the word about all of our tools, from the Knowledge Center on Cancer to the European Cancer Inequalities Registry that we are going to explain you now in detail, to the European Cancer Information System, and also the Knowledge Gateway on Health Promotion, so that they can be used for evidence-based policy making, but also for research. Then, as I mentioned before, sign up to our CESSDA newsletter to stay updated on all of our activities and make sure that you can contribute to that and follow up with us. Then apply as an expert, because that's also a part. If you're working on this field, you may want to apply or disseminate our open calls that we have for expression of interest to be part of the boards and the steering groups of the European guidelines and quality assurance schemes, and also to give feedback or even suggest new potential indicators on the European Cancer Inequalities Registry data tool. That is what Francisco is going to be explaining in just a second. So now I'll give him the floor.
Hello everyone, I'm Francisco Rodriguez. I also work for the JRC, the Joint Research Center, for the Disease Prevention Unit, like my colleague Celia. I'm going to talk about 3 projects we have in our unit. First, I'm going to give you an overview of the European Cancer Inequalities Registry. ESIR. I hope, okay, now, perfect. ESIR, and then I'll say something about EuroCART. This is the European Network of Registries for the epidemiological surveillance of congenital anomalies. And finally, I'll explain our plans to develop a health impact assessment framework and the JRC. So let me start with this slide that I took from my colleague Celia's presentation. As she said, ESIR is one of the flagship initiatives of the European Beating Cancer Plan, and ESIR is part of the KCC, in fact. Okay, ESIR covers the 27 countries of the EU, as well as Norway and Iceland. It consists of several elements and activities carried out through cooperation among us, the JRC, and the DG Santé, which is another DG of the European Commission, as you might know, the OECD, the International Agency for Research on Cancer, IARC, and as well as other organizations that collaborate occasionally. You have below the objectives. As it aims to identify trends, disparities, and inequalities between countries and regions. And the idea is basically that the registry identifies challenges and specific areas of action. And in this way, it can guide investments and interventions at EU, national, at regional level. So this is a general overview of the website of ESIR. You can see here its different elements. We have the topics to highlight the specific topics of interest, ESIR data tool, the country cancer profiles, the analytical reports, cancer inequalities fact sheets, and finally, other information of interest about ESIR. Here, for instance, you can find the ESIR data tool roadmap, where you can find the quality criteria and the indicators to be included each year. So let's start with the ESIR data tool that presents a set of cancer-related indicators to explore and compare inequalities. We have the information organized on two main levels, being the first level, the inequality dimension. We have 8 of them so far: country of region, sex, education, income, urbanization, age, disability, and employment status. Okay, the second level of organization corresponds to the indicators themselves. We have grouped them in several thematic dimensions, following the cancer continuum, from prevention to the quality of life, and of course, cancer burden. Altogether, we have so far 101 indicators in the ESIR data tool, and we plan to include 30 more before the end of this year. This is an example of one indicator in ESIR, the difference within countries, which is the difference between the region with the highest value of mortality and the region with the lowest value of cancer mortality for each country. The idea is to highlight disparities in mortality within the EU countries. Okay, the data tool is mainly a tool to visualize data, so we try to present data in an attractive way. You can see here maps, bar charts, and so on. And this is the process to include an indicator in ESIR data tool. We can detect a possible indicator through several ways. And then we check the availability of data, because sometimes we hear about a potential indicator and then we see that the data doesn't exist. Okay, if data exists, then we check its quality against the quality criteria to accept data. We have 6 quality criteria to be included in ESIR. You can find more information in the ESIR website, in the roadmap. And the data, if the data is accepted, we include this indicator in the annex to the roadmap with the source, the expected date of inclusion. Okay, and we updated this annex once a year. For instance, if one indicator is not available at least in 19 countries out of 29, we don't include this indicator in the ESIR data tool. We explore other alternatives. For instance, we try to collect data. On the short term, we can develop a fact sheet with the data we have. And precisely, this is the following element of ESIR, the fact sheets. We have 2 types of fact sheets. On the left, you can see the thematic fact sheets. They focus on specific cancer-related inequalities, for instance, inequalities in colorectal cancer screening. And on the right, we have the country-specific fact sheets. They include the results of the EU CANINEQ project. This project was developed for ESIR by the IARC. And this project provides country-specific estimates of cancer mortality by education level across Europe. Okay, another elements of ESIR, the country cancer profiles and the EU analytical reports. They are prepared by the OECD and the European Commission, and we publish them every 2 years in rotation. As for the country's cancer profiles, they identify inequalities for each country. We have 2 editions so far, one in 2023 and another one in 2025. And we will publish the 3rd edition in February next year, 2027. And the analytical report that examines policies and actions to tackle cancer inequalities. This is one report for the EU with a horizontal analysis of situation, and we have published 2 reports so far, 2024 and this year, 2026. Okay, let's move on the next topic section. And we have here our main project in ESIR this year. We are collecting existing data from vulnerable groups with the objective of including information in a dedicated topic. First, we have carried out an umbrella review to have a general overview of the situation about the access to cancer care from the vulnerable population, and find the groups with the least information available. This is almost finished. We have already the results that show that the main information gap happens in Roma population and people experiencing homelessness. So the second step is to carry out a systematic review with mainly cancer outcomes, but also for Roma population, we are going to include cardiovascular disease, at least for Roma population. And is it feasible, depending on the final number of articles to review, perhaps also for people experiencing homelessness? This step has just started. With the information collected in these 2 reviews, after summer, we will start drafting 2 scientific reports, and this step should be finalized by the end of this year. And then in the beginning of the next year, 2027, we will include the reports in ESIR in a dedicated topic. Maybe we will produce some fact sheets, and we also want to publish the result, of course. Okay, we are coming to the end of the presentation. Let me explain very briefly other 2 projects we have in our unit. First, a few words about EuroCAT. This is the European Network Registries for Epidemiological Surveillance of Congenital Anomalies. It consists mainly in 40 registries. We at the JRC are the so-called central registry. We have the data of congenital anomaly from all registries, and we analyze this data to monitor the situation in Europe. For instance, trends and clusters of congenital anomalies, possible reasons for these clusters, because we already have a lot of variables in our database. And okay, I think it's a very important project and very useful in some cases, of course, no? And finally, the health impact assessment framework at the JRC. Okay, just in case you know what HIA is. The health impact assessment, HIA, is a systematic process to determine the potential health effects on the population of a policy or project, and very important, the distribution of these effects. HIA provides evidence-based recommendations to minimize negative impacts, and very important, maximize health benefits from policies. The main features of HIA are equity, the distribution of impacts, the consideration of social determinants of health, sustainable development, because it considers short and long-term impacts. Democracy, of course, in participation of people is very important, and of course, transparency and the ethical use of evidence. And this is a tool to implement the health in our policies, no? Because mainly the policies are from non-health sectors. Okay, we have seen that the health is included in impact assessment and evaluation of EU policies, about in the 20% of cases. But we think there is some room to improve the way health is considered and the quantity, of course, of health impact of impact assessment and evaluation that considers health impacts. As at the JRC, we provide independent evidence-based knowledge and science supporting EU policies. We want to support the health part of impact assessment and evaluation of EU policies. The project is still in the very beginning. We are discussing it with DG Santé, and we hope to carry out a pilot with our colleagues from Santé very soon, and let's see how the project goes. Okay, that's all from my side. Thank you very much.